Good afternoon, everybody. It is actually afternoon, just after midday, and welcome to the next in our ongoing COVID-19 series. I'm very pleased to say that we are absolutely topical and on the button, because today we've got Don Berwick, who was appointed by Barack Obama as Administrator of the Center of Medicare and Medicaid Services back in 2010. Prior to that, his work in the US administration, he's been president and chief executive officer of the Institute of Healthcare Improvement, and he's now a clinical professor of pediatrics and healthcare at Harvard. Don is one of America's most influential experts on health policy, patient safety, and the economics of moving health forward. So, Don, it's an exciting morning this morning. We were just talking before we came live. Tell us a little bit about how you think the situation is in America. I know morale is sort of drained away under the previous administration. We're not going to focus too much on the negatives. We're going to ask about the future. I think that a bright new dawn is rising in America as we speak. Don, tell us about that.
Well, of course, it's a tender moment. It's glorious to see finally a president who's going to do the job and can do the job, and that we can be really proud of after 4 years of very destructive leadership. The country's still very divided, and remember, 70 million people voted for re-election of President Trump, and I think we're all worried about whether we can come together as Biden called for in his inaugural address. But we're hopeful. This is a man with a long history of moderate, consensus-driven leadership, and I think he's going to give it a good try. The travesty of last week, when the Capitol was invaded by a mob, was unprecedented in American history virtually, and left us all a bit scarred. But I think we're hopeful. We're really hopeful now. And yes, morale is low. President Trump did not value government, and the signals to the important, what you would call the civil service, our agency employees and leaders was, you're not valuable. We don't need you. And they were mistreated and maltreated. And I'm afraid that there's a rebuilding job to do around morale. But Biden's up to it. And I think his words were tonic for a lot of people who become very discouraged.
Sure, and America is looked at by the rest of the world, especially here in the UK, as the thought leader for the world. And we've been aghast, I think, over the last few years. Do you think that America's position in the world has been damaged, and will it be possible for President Biden now to rebuild that?
Well, there's no question it's been damaged. In Foreign Affairs magazine 2 weeks ago, there was a brilliant treatise on that by Samantha Power, who's now been named the head of the Agency for International Development in the U.S. under the Biden administration. And she wrote eloquently about the kinds and scope of damage. This has created tremendous opportunity for people who are unfriendly to the progressive democratic agenda in the world. More than that, among our friends, I think we've left them high and dry. We have not been part of the global solution that the planet needs for so many different problems, beginning with, but not ending with, climate change, for example, and the pandemic itself. But Biden's an internationalist. He was very experienced in foreign affairs throughout his career. So as important and urgent as the domestic needs for rebuilding are, there are enormous needs for rebuilding trust in the global sphere, and I think this guy's up to it. And his appointments have spoken to that. Some of the people he's appointed to the foreign affairs positions are extremely competent and well respected. And I think we'll see some good turning points. So he's already announced we're going to rejoin the Paris Climate Accord immediately, and he's spoken positively about the World Health Organization and our duties to be leaders in supporting WHO. So the signals are all good.
Great. And when we were talking before, you said there were three priorities, major priorities, of course, more, but three major priorities for the Biden administration. COVID, number one, which we'll talk about for 10 minutes or so. Then equity across the UK, inequalities. We have the same problem here in the UK as they have in the US, with ethnic minority problems, racial problems, etc. And then climate change is another massive issue, which is getting worse, not getting better. So let's start with COVID in America, because we're shocked here. Last week it was announced that the UK has the highest death rate in the world for COVID. And in spite of our NHS, in spite of the best endeavors of our politicians, here we are. And America doesn't look much better. So tell us, how is President Biden going to deal with this problem?
Yeah, well, first, as troubled as I am what's gone on in the United States, my heart's going out to you and your colleagues in the UK and other countries that have been really taking it on the chin in this pandemic. I hope things turn around for you as I do for us. COVID has two central themes in the Biden language. Remember, I'm not inside this campaign or this administration, so I'm only guessing right now based on prior experience and public statements, but it's controlling the pandemic and restoring the economy, which has been devastated by the pandemic in our country in terms of unemployment and insecurity for people. Trump did so little that it's criminal, in my view. We do not have a plan in this country for testing. We do not really have an effective plan yet for vaccine distribution. There was denialism everywhere. There are millions and millions of Americans who still believe that the COVID pandemic is a fraud. So we never developed the solidarity and consistency of communication and science-based policy guidance that any country would need in order to get through this horrific episode. Biden has, from his entering the campaign during the COVID pandemic, through his election right now and to his inauguration, spoken very clear about what needs to be done. One is to face the facts. He over and over again talked about the importance of facts and honesty in his inaugural. This has been his theme, as opposed to the denialism and the disrespect for science in the Trump administration. He's completely reversed that. He's appointed a COVID advisory panel and key leaders who are scientifically incontrovertible, very distinguished people. He's done something quite remarkable. He's now, the president has an office of a science advisor to the president. He has just appointed a very distinguished American geneticist to that post and elevated it to cabinet level. So we now have a cabinet level science advisor, which has never been before. He's honored CDC and their work. His task force is full of people of great competence. He's set up a whole structure for making a plan for vaccine distribution, for a testing plan in this country, and also for he's embedded equity, the search for equity, right in the center of the COVID approach. None of that has happened or is complete yet. He hasn't been president. So all of this has been planning and talk, but if the right people matter, he's got the right people. And I'm quite hopeful that we'll be able to turn this corner. One of the challenges is solidarity. I don't know whether you've seen in England and the UK the same split that we have, in which political division has been replicated in division of attitude toward the pandemic and science. You can almost tell whether someone is a right-wing Republican or a left-wing Democrat by whether they're wearing a mask or not in this country. Mm-hmm. So we politicize science, which has been extremely costly. 400,000 Americans so far are dead from COVID, and it's terrible. There's a period of mourning going on right now. The day before the inaugural, there was a very moving ceremony at the reflecting pool in front of the Lincoln Memorial, where Biden was, with 400 beacon lights lit, one for every 1,000 Americans who have died in the pandemic. So there's a reckoning going on.
And where will Dr. Anthony Fauci, will he continue in his post, or because he's sort of reached hero status in the UK, as opposed to the politicians who certainly wouldn't be described as heroes. But Dr. Fauci, he'll stay, will he?
So far, yes. Biden has made it clear that he values Fauci's advice, and his formal position in the U.S., which is head of the component of the National Institute for Health that focuses on allergy and infectious disease. He remains in that post. So I expect he'll be very prominently valued. But there are many other appointees he's made. He's just appointed a former FDA commissioner, Dr. David Kessler, to oversee the issues of vaccine preparation and distribution. He has, as I said, made this presidential science advisor cabinet level post. He's got a distinguished advisory group. So he's really, he's loading up the competence for this. Whether he can carry out what he wants will depend on Congress, and that's a different story. We have for the first time in decades, a single party. The Democrats have won the House, the Senate, and the presidency, as you know, but the Senate margin is razor thin. It's 50-50. We have equal number now Republican and Democratic senators, which by our Constitution means that the vice president becomes the deciding vote for Senate votes. So he can get statutes passed, but it's more complicated than that. Number one is some of the Democrats are even more centrist and may not stay with the program or may push back. And there's an odd feature in American legislature, which is that the filibuster, which for many laws allows us opposition senators to just start talking, and they can't be shut up. They can talk as long as they want. They can stop a bill, and you need 60 votes, not 50, 60 to override the filibuster. And as long as that's in place, it makes passing legislation hard. So a lot of what President Biden has to do now will depend on his ability to use executive authority, executive orders, regulations, guidance instead of statute when he has to move swiftly.
Right. Yeah, it's going to be so interesting to see that. Well, he's made a promise, I think, to get 100 million vaccinations done in 100 days. I mean, wow, that is one amazing commitment. That's almost half the population, isn't it? I mean, is that doable, feasible? And
I'm glad he said he'll do it. I mean, we need it. I need it. But it's hard, and they're not on track. And the inside journalists have been writing that there's already been some concern and controversy within the administration as to how they're going to get this done. He's made important personnel moves. They say policy is people. So if you judge what's happening by the people he's appointed, he's brought in some pretty heavy hitters on logistics. And people are comparing this challenge to the problem of wartime mobilization in the period of Franklin Delano Roosevelt, when you were already at war. In World War II, we had a totally stripped down military. We didn't have tanks, we didn't have planes, we didn't have personnel. And in a very short amount of time, against a lot of public concern, FDR famously mobilized the country. I think we were producing an airplane every 4 minutes or something like that by the time he was done. So people are saying it's the same kind of mobilization effort. And of course, it's the whole chain. It's from vaccine manufacturing to distribution to the cold chain. And then most importantly, the public acceptance, because we still have, I think it's over 40% of Americans say that they're either skeptical of or would not take the vaccine. So it's hard, especially if the new strain emerges with a higher R0, we're going to have to get more of the population vaccinated. And there's going to be a kind of public relations or educational job to bring Americans into the vaccine regime. I think that'll happen, but it's not easy.
Not easy, especially in the world of social media where anti-vax is pretty prevalent. If you read, especially in the sort of darker parts of the web. And what about the provision of healthcare? I know, Don, I mean, you've been criticized for being a supporter, defender of our National Health Service, which I think has stood up pretty well in during this pandemic. Although we see daily programs on ITV and BBC about how the hospitals are struggling, the ITUs particularly struggling. But I mean, how do you think the American healthcare system will be able to manage with a pandemic that is still raging? And what will Joe Biden do? What can he do to change the system so to allow equity amongst the population in terms of healthcare?
Yeah, we have an underperforming healthcare system, to say the least. That's been my career, working on that and trying to make it better. And I have enormous respect for the British National Health Service. And the controversy in the U.S. is that, for me, to personalize it, is that I have become, I've come to believe that we would be wise in the United States to adopt not a national health service, but national health insurance. I'm comfortable having private delivery, but I think a single public insurance system would be better for many reasons. Not perfect, but better. And you're right, I've been heavily criticized for that position. And that's not Biden's position. Biden's position is that we need to expand coverage. We still have 30 million people in the United States with no health insurance, despite the success of the Affordable Care Act. And that went down. We had fewer people covered at the end of the Trump administration than at the beginning by many millions. So Biden has made it clear that moving toward universal coverage, but through less dramatic means that a national health insurance system will be part of his agenda. And I think your audience would be bored if I went through the many components of how that gets done, but we have a complicated payment system, and it's every single element of the payment system is now on the table. He has proposed a so-called public option, which means essentially right now, one is eligible for Medicare, which is our government insurance, our main government insurance system when you reach age 65. He has proposed to lower that age of eligibility to 60 with private, which you could choose to buy in. And he's also proposed to add a public option, which would essentially be anyone that wants to buy Medicare as their insurance, even if they're not 65, could do it. Those will require statutory support. And as I said, the margin, the thin margin in the Senate makes legislation not likely, but he's spoken strongly in favor of healthcare as a human right and taking moderate but clear steps toward that. Then the equity issue emerges. It's a COVID issue first. COVID has selectively killed people of color in our country, approximately 2 or 3 to 1, at least for African Americans and Latinos. That's a reflection of overall inequity in our health system and in our economic system. People of color they're in the low, they earn lower incomes. They have more problems with racism, structural racism. And Biden has made it his very clear agenda to make this the era, his tenure, the era in which America really starts to reverse that. The problems are economic, cultural. The economic problems require a more generous policy of social support. And he has, in the COVID pandemic legislation that he's proposed ways to get relief to people of lower income with direct subsidies to support unemployment insurance much more generously, and to assure that the minimum wage in this country goes up for people who have been really given the short end of the stick. A lot of them are people of color. He's also, as I said, appointed a cabinet and other presidential appointees who are very diverse. We now have the first Native American ever in the cabinet, our Secretary of Interior. We have numerous people of color in cabinet positions. We have the first transgender person has now been appointed to a deputy secretary position in HHS, not appointed, but proposed. So he's walking the talk. We're seeing a very diverse cabinet. And I think that's the beginning of changing public sensibilities toward a much more inclusive society. We lack solidarity in America. The one thing I notice when I'm working with my friends in Europe is there seems to be, I don't want to be naive about it, but there's an underlying pedal point of public policy belief in being together, discharging duties to each other and doing that through government. And the United States is very ambivalent about that. And I hope to see that change.
The question asking whether you've been approached to work in the new administration, Don. I think you were advising before the transition, weren't you?
I was very privileged. Yeah, for months before the transition, I was part of the Biden-Sanders Unity Task Force, which was trying to come up with policy proposals for the Biden campaign and the Democratic Party that would cross from the more far left to the center, and we did it. And then I was on the co-chaired one of the subcommittees of the Health and Policy Advisory Group. So I was privileged to be able to advise. I'm not involved now. I've not been offered a position, and as I say, I'm delighted with the people that he's invited to join him.
Sure. Well, there's Richard Simpson pointed out that Dr. Fauci's been appointed to liaise with the WHO, which Biden has announced. So thanks for that information, Richard. I should have known that, I suppose. Then Ali Herbert's got quite a good question. With all the different states, has this caused some of the big problems that are present in the USA? Is there a need for this to become a federal issue rather than devolving all the responsibilities? Because states have differed so much, haven't they, in the way they've handled this?
Definitely, yes. We are a federal system, and the states have tremendous power and authority and independence from the federal government in important areas. That has gotten more marked in the Trump administration. Trump, for example, in his policies toward the pandemic, has his basic, if there is any policy, and it was hard to find it, has been delegate to the states. Everything's up to the states, up to the governors. So even things like releasing the national stockpile of ventilators and other things. He said it's up to the states. And so the states have had to pick up a lot of the slack. And because we're very divided as a nation, this kind of red-blue division, as you know, there are states that voted heavily Republican, even in this election where Biden won. There are states in which 60 or 70% of the people supported Trump. And this division has been deep, and it continues. Within states, there are also divisions. So there are many states, some states in which you have, say, a Democratic governor and a Republican legislature. So the states have difficulty moving. So we have to navigate through this federalism. I don't think it's going to be possible to have effective vaccine coverage or effective national testing system without much more cogent and serious federal leadership. And I think the states will welcome that in general. I think they were filling a vacuum. But we're a mobile society, so to have a state-by-state testing strategy, I mean, there are adaptations, I guess, that should occur across states, but we're crossing state lines all the time. And vaccine distribution, it's a national supply chain. We have to have that orchestrated for us and with us by the federal government. So you'll see, even though, as I say, Biden is a moderate, he will, I think, have to and will step up and show that the federal government has a key role here.
Yeah, it's there's a good question from Valerie Brancato sent in ahead of it. She says, "How do we build faith, confidence, and trust in our scientific agencies after 4 years of denying the virus, science, and climate change?" I mean, how it's easy to say Biden wants to do this, but the question is, how do you actually do it, especially against this background of all this noise on social media?
I don't think there's an easy answer. My answer is from the kind of the manual on pandemics and emergencies, which is consistency of communication. One must decide what one believes as a leader, and over and over and over and over again, make that the communication. People need to hear consistency or they get confused, of course. Trump was a master of inconsistency. You never knew what you were going to hear. And if one person Fauci said one thing and Trump said another, it's very confusing to the public. It means first, it's hard to mobilize concerted energy, and it's hard to mobilize the kind of trust your questioner is asking about. So we need a team. I think that the way Biden has assembled his team, the people he has working with him, they're terrific. And I really do believe you're going to hear a much, much more consistent set of messages. And it's not just any message, it's science. It's science-based policy, not for absolutely everything, I guess, because sometimes it's the questions are purely moral, but science helps. And we have some recovery to do now to rebuild public trust in science as a foundation for public action. That has to do with climate change. It has to do with COVID. It has to do with understanding the causes and forms of relief of poverty and hunger and homelessness. And I think we have as we say, we have a president now who has, from day minus 100, embraced and valued science. I think that's a really, really important step to take.
Yeah. Well, coming back to vaccines, we'll move on to climate change in a minute, but coming back to vaccines, it's a plug for in 2 weeks' time, we're going to be covering the rollout of vaccines on our COVID series. So listeners do tune into that. But in the UK, I think they're given 4 million vaccines now, and they're just experimenting with the sort of 24-hour-a-day vaccines. But I think the rate limiting step here is already beginning to show, which is vaccine production. So I imagine, Pfizer in America and Moderna and the other vaccine producers will have their factories kind of geared up. But are they going to be able to produce 100 million doses in 100 days?
I don't have any information that allows me to make a confident estimate. Let me just editorialize. I think the RSM series of seminars and meetings that I attend regularly has been one of the best possible sources for information about this pandemic. So thank you for doing that. I get a lot of what I know from RSM. I think they're up to it. I've been on a National Academy of Medicine committee, which had taken testimony from manufacturers of both vaccines and treatments. And it looks promising. It will take a lot of support, a lot of encouragement, but I think the production, my own personal opinion is production may not be the issue. It'll be distribution in a very complex country with very complex healthcare and now a period of uncertainty about authority and responsibility. So I think it's the supply chain end of this that's going to be most vulnerable. And then, as we said earlier, public acceptance. The other thing about vaccines, maybe your upcoming session will address it, is public uncertainty. There's public uncertainty just because of anti-vax attitudes, but also remember these vaccines, they're new, and so building trust around these forms of prevention is very important. I've trusted them now. I trust them because the scientists that I respect speak for them. But one would be sympathetic with the public who's saying, "Are you sure? Is this okay?" And I think we're going to build that. Whether we can do it fast enough to get to 100 million in our country, or you and your rollout, I don't know. There is also the other uncertainty, which is looming, is whether there will be vaccine escape, immune escape by this virus. So far, not, as far as I understand it, but I think we're all worried about that. And that's we're going to be very diligent about following this pretty smart virus. The other thing I have to say, Roger, is this is not just a matter of the technology of distribution or commitment to internal equity in my country. It's a global equity issue. And I really hope we can, at a planetary level, come together and decide just how fair we're going to be about letting these resources go to everyone, areas of need, in some fair way. We don't seem to have a regime yet designed for that, but we have a problem with commitment to global solidarity. And I don't know, somehow if we ring fence every country in the world, there's going to be a lot of people that get hurt.
Yeah, well, there are anxieties about that in the UK. Our politicians tend to say, "Oh, we've done 4 million and the French have only done 400,000." So, harping back to the 100 Years' War against the French. But there are massive issues in terms of India and Africa and getting the vaccine down there. So, yeah, I don't know where that's going to go. I have to say, my wife and I have been vaccinated and we're still alive and kicking. It didn't feel a thing and no side effects at all. So yeah, a living proof the vaccine is painless because I'm a healthcare.
We're very lucky. I mean, what the vaccine producers have done is quite impressive. I mean, this is a short run up to a very effective vaccine, and I hope we can begin to believe in that.
Well, Don, I'm just going to give another plug for the RSM since we've got an audience. We're lucky to a donation, philanthropy to pay for a series on climate change. And I just heard yesterday that Prince Charles is going to record a 2-minute intro for us. So we've got royal backing for the Royal Society of Medicine. But let's talk a little bit about climate change, because this pandemic is going to go away, just like the plagues of Justinian and the Roman Empire went away. But climate change isn't going away. So what are your thoughts on that, and what can the Biden administration do to change global attitudes to climate change?
Probably should disclose at first that this is my wife's field. Anne, my wife, is an attorney and environmental lawyer who has been Undersecretary for Energy in our state, chair of the Public Utilities Commission, currently sustainability director for our city. So I have the advantage of getting tutored about climate and energy and decarbonization a lot, and I value it a tremendous amount. It is a massive, massive problem, and the U.S. has been an ostrich on this in the past 4 years, just stuck our head in the sand and withdrawn. It's dire, and I'm just reading a book which I'll plug called "The Ministry for the Future." The Ministry for the Future by Kim Stanley Robinson. It's a fictional account, a novel, but it is a wake up call. So Biden's been quite clear about this. He's put it near the top of his agenda list. He sees it, as I see it, as also related to economic recovery in our country. One could imagine a very good developing industry set around decarbonization and climate that would help any country that gets invested in it, and we've fallen behind. Trump has been devastating on this, did terrible things around wind power. Wind power is very promising in the US, and he's basically chilled it right now. But Biden's coming out of the gates ready to tackle this. He has made two brilliant appointments, John Kerry for global climate relationships, and a person named Gina McCarthy, who's revered in this country, a former head of EPA, the American Environmental Protection Administration, will be the domestic head. So again, if policy is people, he's shown his cards here. These are very competent and charismatic people. And I think there's a sense of urgency. And I think I believe he said one of his day one executive orders was going to be to rejoin the Paris Climate Accord. So we're moving in the right direction. This is controversial in our country still. There's a red-blue split on climate denialism, on issues about how fast we can get off coal and oil, and whether these are what's an economic loser or winner, and all of this has to be worked through in a very divided Congress. But he's done everything so far right, and I think that if we can get a Congress that wakes up more on this, we will make some progress. But it's really urgent. I mean, if I don't have to tell you, and I look forward to your series, but when we begin to look at climate caused weather events and fires, dislocated populations, water insecurity in the subcontinent, the food insecurity, climate wars. This is as bad as the pandemic is. This could be worse.
Yeah, and I think in our lives, I'm age 70 now, and in my life, since 1950, you can see it happening around us. We had a storm through here last night, Storm Christoph, they called it, across the Atlantic, where flooding in Yorkshire, and weather conditions are becoming now so not uncommon, so common, extreme weather conditions. It's got to be climate change causing that.
This may be relevant to the RSM, but our National Academy of Medicine, part of the National Academies of Sciences, Engineering, and Medicine, the president is Dr. Victor Zhao, who you may well know. And Victor, at the 50th anniversary of our National Academy of Medicine, I know that's a low number for the UK, but that's how old our National Academy of Medicine is. Victor announced that among his priorities, his grand challenge priorities, a very small number will be climate and health. And I'm delighted by that. I'll help any way I can. And I think to have our academy step out on that is important. And I think you in the UK have benefited from the leadership of the Lancet, which has really been a pioneer in pointing out the climate health relation. So we may see, at least in our scientific and professional community, a rising set of concerns and commitments to working on climate in both directions. That is, healthcare's footprint on climate and carbon, and climate's footprint on disease and health, and we need that.
Yeah, because I've been thinking a lot about this recently, about how health and climate go together. I mean, for a start, the medical profession are very highly trusted in North America as well as in the UK. So we're amongst the most trusted people, a lot more trusted than politicians, that's for sure. So we have a voice and we have an influence. I think standing up and speaking about the problem would be good, and also that there are very direct effects of climate change on health. Air pollution and the rise in lung cancer in people who've never smoked, for example, asthma, heart disease, and so on and so forth. So yeah, I'm really excited about the possibilities of healthcare people standing up, and I think it'd be great if from America, where your voice is 5 times larger than ours because of your population and your other things, it would be great to have that coming from the American health organizations too.
Yeah, for your listeners and your members, I believe the National Health Service has stepped out quite importantly on this in terms of decarbonization, not atypically leading thinking in the world. And I think if the professionals in the country can join with the health service in an aggressive agenda demonstration about what's possible in terms of healthcare's footprint in climate, that will be all to the good.
Yeah, well, I'm a surgeon. I used to be shocked at the end of an operation of just how much stuff got just put in a bin and sent for incineration, and then all the particles out in the air. Don, how much more time have you got? I know you've got another thing to do. You're okay?
I'm
So,
okay as long as you need me.
well, let's talk a little bit then about inequity amongst health, because that is a big problem, and not just in health, but inequity in terms of education, in terms of socialization. So many aspects of our societies show this. What's the solution to that problem?
Well, I take my lessons in this from many people in your country, perhaps first among them, Sir Michael Marmot. And Marmot, in his book in 2015 called The Health Gap, did us all a great service. Sir Michael, he sort of redacted or classified, organized really a century of research on your question on what causes inequities, the health gap. Mm-hmm. And in a very cogent way. That book's a gem, and I recommend it. He of course recites the dimensions of the health gap, which is massive. In my country, for example, in the city of Chicago, you can travel 3 miles on the public transportation and lose 16 years of life expectancy. Famously in Glasgow, where Sir Harry Burns did some of the early work, when that was studied at the beginning of this century, you got a 27 year gap, I think it was, in life expectancy within a single city. London, it's 10 years between Oxford Circus and Star Lane. So these are enormous place-based differences which relate to the circumstances of the populations. In Marmot's book, he says there are 5 agents here. 5, when we say social determinants creating this gap, it is the experiences of early childhood, adverse childhood experiences, which redound into massive differences in health status in adulthood. It's astounding differences. And we're talking about 2 or 3 times the rate of cancer, heart disease, 10 times the rate of certain mental health issues. When kids are stressed, they're adults who are unhealthy. The second category is education, the equity and dedication of an education system. The third is workplace conditions, minimum wage structures, adequate wage structures, fairness in employment, safe working conditions. The fourth category is elder care, the way societies deal with elders. And the fifth category is community. He calls it community resilience, or Michael says community resilience, but he means a whole collection of community circumstances like the adequacy of transportation, food security, housing security, violence prevention, recreational opportunities. These conditions, early childhood conditions, education, and so on, they're very maldistributed in my country, much worse than yours. And as the consequence is the inequity in outcomes. And this is science, this is not politics. So countries that want to live as long as they can and to have equity among populations have to address these causes. And that's what perplexes me, certainly in my country, even in yours, where we put the causes of health disparity in the back seat while we invest our resources in the repair shop. Lord Nigel Crisp has just written a book. I think it's called something like Home is for Health, Hospitals are for Repair, or something like that. But he's right. We're putting all our money into repair without working on the causes. Even in the UK, where you have a much stronger social support system, you're relatively still underinvested in social services. And when things get stressed, you protect the delivery system, the repair shop, more than you protect the social services. In my country, it's far worse. Marmot, interestingly, has another claim, which is that all of the above, education, early childhood, elder care, all of this he calls it the cause of the causes is a sense of fairness. And he has a very eloquent exegesis on fairness in society and whether we want to be fair, that's the solidarity point I was making. And his claim is that societies that commit to fairness live longer because they carry out public policy that invests in the causes of illness. So that's the science. There's a moral undertone to all of this because maybe you don't invest in fairness. Maybe you don't believe we're all equal. We're all worthy. If you don't believe that, then you don't invest, and then you lose health.
So Michael Marmot's just agreed actually to do one of our In Conversation series, so we can develop that with him. But it comes back in a way, doesn't it, to that red blue divide of politics, because you're trying to persuade the right wingers that redistribution of wealth, which is mainly held in their hands on the red side rather than the blue side, that's something they're going to kick back against. So, I mean, this is not an easy issue, is it?
No, and it's not just the wealthy. I mean, what's happened in my country, I don't know about in England. Well, I guess we did in the Brexit. If I say the Brexit mistake, if I can be arrogant about it, it's people of disadvantage, people who are being hurt, somehow are made to be convinced that the cause of their injury are other people of disadvantage.
Yeah.
It's a weird dynamic. Instead of pointing the finger where it should be pointed, which is toward greed or withholding of resources instead of generosity, they are taught, I guess, or convinced to blame someone else who's also in trouble, perhaps because their skin is a different color, or they come from a different country, or speak a different language, or are simply unfamiliar. And the result is bad policy in which the necessary forms of generosity in society don't take shape, and people are taught to fight each other instead of to fight the problem. Your country's got a longer history of solidarity. That's where the National Health Service came from. But as I think I'm not being unfair to say, it also plays out in the UK. In my country, it plays out in the voting booth and state by state politics. And we are 30 million people without health insurance in the wealthiest nation on earth. It doesn't make sense. If we have 40 million hungry Americans today, 17 million children in food insecurity, 600,000 people in my country with chronic homelessness. These are numbers which ought not to exist in countries as wealthy as ours, and they come from this sense of othering and distance instead of a sense of possibility that we can help each other.
Yeah. We better get close to closing, Don, because we're supposed to be half an hour and we're nearly at 3/4.
Oh my God, I'm so sorry.
No. Actually, there's one specific question which is quite hot in the UK at the moment. I'm not sure whether you'll have a view on this, but Richard Simpson says, following reports from Israel on lower immunity from one dose of the vaccine, do you have any view on the decision they made over here to delay the second dose from 3 weeks to 12 weeks? I mean, that's a political decision, and actually it illustrates the kind of that tension between science and politics. Because any thoughts on that?
I shouldn't close on my ignorance. I don't know. What I read is that single dose protection is not sufficient, and we really need to have, for these current vaccines, 2 doses. And but I'm not an expert on that, and I wouldn't trust myself as the advisor. Again, this is a matter of positioning science correctly, and you need a set of trusted people to guide the policy. And I wish I knew more. I wish I knew enough to answer Dr. Cruz's question, but I don't.
Okay, well, we'll be addressing it in a couple of weeks' time. So listeners, do tune in. Don, thank you so much. I mean, I just want to finish with a statement, because I got a few emails before saying, they were worried this program was going to be negative about American medicine, and who were the British to talk about medicine in America. And I have to say, I've done a bit of my training in America at Hopkins and at Memorial Sloan Kettering, and there's absolutely no question that the best American hospitals have the best healthcare in the world. They are number one. I guess the problem comes from the fact of those 20 million people, 30 million, did you say, who don't have health cover. So that's the issue, and that is obviously a big issue. Don, thank you so much. You have an open standing invitation once the aeroplanes start flying again and the pandemic hopefully comes to an end, to come and visit us. We'd love to have you and your wife actually to come and talk about climate change. We'll have a session in the RSM and beam it out on Zoom. So thank you so much. I think it's the 3rd time you've appeared for the RSM. You're one of our regulars now. So brilliant thoughts, such a brilliant overview. Thank you very, very much. And just before you go, just an announcement that Simon Wesley is busy next week with his roundup of answering your questions. We've had 50 questions today. I haven't had a time to go to ask many of them. I do apologize, but we do look at all your questions, I promise. And Simon, in his roundup at the end of the month, which is now a regular feature, will be addressing some of those for us. The In Conversation series continues. So next Wednesday evening at 7 o'clock, Simon again will be talking about the Holocaust. We have a Holocaust survivor, 100 years old, who lived through that. So that's going to be really, really interesting. Remember, these webinars come to you free, but they're not free for us to produce. So if we have any philanthropists out there tuning in, please do feel generous and send a donation into the Royal Society of Medicine. So thank you, Don. Thank you so much for your wonderful thoughts and interactions. It's been a pleasure having you, again.
Goodbye. Pleasure. Thank you. Bye-bye.